Half of the world's population will experience a mental health problem in their lifetime. You likely know somebody who's going through a mental health problem right now. Currently in England, at least 1 in 6 young people will experience a mental health problem, with suicide being one of the leading causes of death in this age group across the world. Do you remember what it was like to be a teenager? I'm sure most of you can relate to the difficult transition that adolescence brings. It's not easy. But when you're struggling with a mental health problem, particularly with self-harm or distressing extremes of emotions, this is made so much more difficult. The number of children referred to emergency care for their mental health has increased by more than 50% in the last 3 years, meaning that more than 600 children a week are reaching crisis point. For families of these young people, there is a huge gap in support. You may have heard the phrase, "you can't pour from an empty cup." So how can we expect parents and families to support their children when they're in such need of support themselves? So what do I want to do about it? As a lived experience researcher, I have personal motivation for this project. With my research, I would like to contribute to a better future of mental health care. For my project, I will be conducting interviews and focus groups with parents and families. This way, I'll be able to get richer and deeper insights into the perspectives of these families. What do they feel is important and what do they think needs to change? I'll also be speaking with clinicians who might work therapeutically with these families, such as psychiatrists or psychologists. The data we get through these interviews and focus groups will be used to design a practical solution that is fit for purpose. This will all be done using a co-design process, which means together with my participants, we will develop a new therapeutic intervention specifically for families. Also, this is a collaborative project, part of a brand new partnership with the UK and Australia. And what makes this so exciting is that the potential of my project is not only to implement a new intervention into real-world practice in the UK, but also in Australia. My research aims to give voice to an underrepresented population. The co-design process is so unique in that it invites people with lived experience to be part of the design and implementation of services. Who else is better to input into a service than people with lived experience? Potentially, this research will reduce psychological distress and reduce the pain and conflict experienced by these families. Everyone deserves to be supported in their mental health and get the support when they need it and how they need it. This research will make it possible.